Smile imaging allows patients to see into the future. Click on the patient's photo that you'd like to image. From the top left-hand side, there's always flashing instructions prompting you on what you would like to do. Click on the procedure you would like to use. In this case, we're going to click on crowns and veneers, and then following the flashing instructions, zoom in on the slider bar down here at the bottom. Make the picture nice and big. That makes it easier for you to go around the lip line. As we're doing a full smile makeover, we're going to go all the way around the lip line. Obviously, if we were just doing a single unit crown, we would just go around the one tooth in question. Apart from that, everything is exactly the same. Follow it as neatly as you can. It doesn't have to be perfect, but make sure that you go outside rather than inside the lip line. If you go inside, obviously we will still be able to see some of the existing teeth, and so the finished image will then not look as powerful as it could. Once you've gone around the lip line, go up to the top left hand side where the next button is flashing and left click on there. Now you can see how fast and effective the software is, allowing your patients to see into the future. Instantly, the first smile has gone into the patient's imaged photo on the right hand side here. There's 30 smiles within the library on the right hand side. The software will always put 301 in first by default, but then you can click on the various smiles to choose the correct shape of tooth that you would like. Once we've got the right shape that we'd like to use, we've got full control. We can move the teeth around by clicking into the centre of the box. We can use this square box to adjust the size of the teeth, and we can use this half moon arrow to angle the teeth. Once you've got the teeth roughly in the right position, we can then make it as anatomically correct as possible from the top right hand side. I'm going to put a left tick in the adjust transparency box and the stretch box. Now that box that's appeared, you can see now when I move it down, we can lengthen the teeth and size the teeth. So we can make the image as anatomically correct as possible with a two-dimensional photo. Once you've got that as you would like, take the adjust transparency off and the stretch box, and we've got a really neat tool then, the curved bite line. If I move it to the left, you'll see that we've got the reverse smile, and as I pick it up to the right, it looks more like her own smile. So as you can see, setting patients' expectations is no longer an issue. As you've got complete control, you can change the colour, the size, the shape and the position of the teeth. So we're now going to look at the colour. So up here on the top right hand side, I've got the colour slider bar. You can move that along and you can see the yellow going into the smile. Okay, and the teeth brightness, we wanted to give a bright Hollywood smile, we can do that. Or obviously we can take it down and make it sort of a more natural smile. So discussing with the patient, with them, their expectations, you can make this a very powerful communication tool that patients understand. Once you've got it as you would like, you can click on print from above the photograph there, and you've then got the photo ready for the patient to take away. Imaging means that the patient can visualise how their smile could look, exciting them in a way that they can say yes faster to treatment. You can ethically deliver this in less than a few minutes, as you've seen, and as you can print this photograph out with all of your dentist's details on, as well as the disclaimer so that you're covered medical legally. You can see how fast, effective and powerful this software really is.